All right, good morning. I'm Gina Ford. I'm Communications Director for Prince George's County Executive Angela Alsobrooks. We'd like to thank you all for joining us this morning. This has been quite a long 2 years, and so we have some exciting announcements. You will first hear from County Executive Alsobrooks, followed by Prince George's County Public Schools CEO, Dr. Monica Golson. And we'll close with Dr. Askew, but also Dr. Carter is here for any questions and answers that may come at the end. Thank you.
Good morning, everyone. It really is a great day, and I'm very excited to be here with all of you all to give you some updates regarding COVID-19 in Prince George's County. I'm joined by what I've been calling the Super Bowl team in Prince George's, and so I'm so proud and so honored to be joined by Prince George's County Public Schools CEO, Dr. Monica Golson, who is incomparable. And I would dare say, without exaggeration, is one of the strongest leaders in the state and certainly one of the strongest in our county as well. I'm also joined by a pair of pediatricians. And if you didn't know it, we really did, I would say, step on a four-leaf clover when we had the good fortune of bringing on board two pediatricians who are leading our health efforts in Prince George's. And unbeknownst to us, it was going to be really fortuitous for us to have pediatricians leading a pandemic of this nature where vaccines and other things were involved. And so I'm also really pleased to thank Dr. George Askew, who is our Deputy Chief Administrative Officer for Health, Human Services, and Education, and to also welcome and to thank our Health Officer, Dr. Ernest Carter, who is here this morning as well. And I just want to take a moment to thank them, and I don't even have enough words this morning to thank the three of them for their hard work and for the role that they have played in helping us to make it through truly one of the most challenging times I think anyone in our county can remember. I think I would be remiss if I did not also thank the teams of people who work with them, all of their colleagues, both in the school system as well as in our health department, who have just represented us so expertly and with so much compassion and skill and sacrifice. And so I certainly want to also give a very, very special thank you to our health department employees as well as all of our school system employees as well. We have made significant progress also because of one other member of our team, and it's as a body, that would be the residents of Prince George's County, without whom we certainly could not have made it through this pandemic. And so I want to say my final thank you for Prince Georgians who have worked with us, who have listened to us, who have made every sacrifice imaginable, even in the darkest days. And so I want to thank them because together we have really made quite a difference, and we are making it together through this pandemic. I think we all remember the earliest days of this pandemic. We stood right in this room with so much uncertainty and some fear as well. And we knew at the time that COVID-19 arrived in our community that we would be disproportionately impacted. And that was because of many of the comorbidities that existed in Prince George's County. It's because of the historic lack of access to health food, the historic lack of access to health care. And so we were impacted disproportionately, I would say, not only in the state, but our impact and the high rate of infection and disproportionately infected us in the region, made us stand out. Now, we could have chosen in the very darkest days, our residents could have said, I'm going to look out for myself only and my family and go my own way. But we know that Prince Georgians are made different than that. And so together, we have made sure that we've done everything, practiced social distancing. Prince Georgians wore masks without complaining. In fact, many of them called me to make sure we continue to wear the mask. They protected themselves, they protected each other, they stayed away from family gatherings and really did sacrifice the opportunity to celebrate some milestones that would have ordinarily been celebrated together. They made that sacrifice. And as a result of it, we've gotten through the worst, we believe, of this pandemic, and consistently we've maintained over the last several months, and I think this is so important, one of the lowest transmission rates in the state exists right here in Prince George's. Now, during the holidays, we saw Omicron surge, and this came at a time where our residents were exhausted by the pandemic and they could have given up. Instead, they continued to follow our health guidelines, took extra caution to protect themselves. They did not complain a single moment, and they continued to take care of their families. And because of Prince Georgians, who I just couldn't thank enough, thank you, Prince Georgians, We now have the lowest transmission rate in the state of Maryland. And as of this morning, our transmission rate is 44.98 cases weekly per 100,000 residents, which places us at the CDC's moderate category for transmission. And in fact, what I think is most significant about where we are, again, given the fact that we started at the highest transmission rate, not only in the state, but one of the highest in the region, our numbers tell us that we are the only jurisdiction in the state of Maryland that is presently in the moderate category. And so we are the only county that has been able to achieve that. Just 2 weeks ago, the county's percentage of positive rate of test was at 5.16%, and our positivity rate now is at 2.29%. And I'm sure, and Dr. Carter and Dr. Askew can correct me, I'm sure this is one of the lowest rates we've seen even since the beginning of the pandemic, which drops us below 3% for the first time this year. And so Dr. Askew, I know, can talk about our hospital capacity, and Dr. Carter more later, but we've also seen our hospitalized COVID-19 cases drop 36% in the last week, and we have also seen a remarkable turnaround from where we were at the beginning of the pandemic, even where we were actually a few weeks ago. And so it is a credit to the expertise of the men and women in our health department, the dedication of all of our frontline workers, who I also want to thank, who made tremendous sacrifices as well, and also the resilience of our residents. We continue to see the benefits of Prince Georgians also who choose to get the COVID-19 vaccine. And according to the Centers for Disease Control, almost 92% of our residents 5 and older have at least one shot of the vaccine. We know that 72% of our total population is totally vaccinated or fully vaccinated. And over 40% of our residents who have gotten, who are fully vaccinated have likewise received the booster shot. And so if you have not yet joined the ranks of those Prince Georgians who are proud to be protected against COVID-19, there is still time. And we ask you and urge you, please, to take the soonest opportunity possible to get yourself vaccinated, and for those who have not done so yet, to go ahead and get yourselves boosted. We urge residents 5 and older to get vaccinated as soon as possible, and to please get tested if you have symptoms or have been exposed to COVID-19, regardless of your vaccination status. And I want to thank all of our residents who have chosen to get vaccinated. I know I'm well down the road of bragging, so I may as well not stop now about Prince George's County, but you should know that we likewise have one of the highest vaccination rates in the state, and so Prince Georgians have totally crushed COVID-19. From the very beginning of the pandemic, we said that we would listen to the experts. I promised you that we would make all of our decisions based on science and medicine, and we would be guided by data, and we would follow what that data said. And so accordingly, everyone's collective efforts have now caused us to be in a place where we are trending in the right direction. The latest data revealing how low our positivity and transmission rates is really good news for us. And after consulting with our health officials, these recent trends have led us to decide that we are lifting the indoor mask mandate effective Monday, February 28th. I have waited a very long time to say that it is safe for us to do this, and so I'm thrilled beyond measure. But this Monday, February 28th, we are lifting the indoor mask mandate. We are continuing to make every decision based on the safety of our residents and making sure that that is what is most important to us. And when the data required it, we put the mandate in place. And now, given our vaccination rates and the current low rates of community spread that we are seeing, our health officials have advised us that this is a safe decision for us to make. I know that this news is a welcome relief for many of our residents. It's been long. It's been a frightening 2 years for so many of us, from the early days of uncertainty and demand for COVID-19 tests to the anticipation of the vaccine. But I also know that there are many of our residents who need to move at a different pace. And and some of those residents are not yet ready to take off their masks. I've heard from many of them. And so today's announcement signals a transition into the next phase of our fight against COVID-19, but it does not mean that COVID-19 is gone from our community. The Omicron surge came just as we saw light at the end of the tunnel. We were all believing that it was moving, and we saw that Omicron came upon us with a vengeance. And we knew that even at that time, many of us who were vaccinated, fully vaccinated and boosted, myself included, who felt we were doing all the right things, still tested positive for COVID-19. And so I know and understand the concern of any resident who says at this point they are not ready to remove their masks. And so if you are still hesitant about removing your mask in public, I want you to know that we all support and respect it. Nobody will force anyone to remove a mask, and you can continue to wear your mask as long as you feel comfortable. I want to tell every resident likewise to please, ma'am, please, sir, please be respectful of all of those who are still choosing to wear a mask. And we want to continue to be the kind of neighbors and loved ones that we've been all along, and to be respectful and to continue also in the spirit of togetherness that we have seen and experienced throughout this pandemic, and so that we will respect the choices of each other regarding the mask. Our residents must keep in mind that while the county's indoor mask mandate is lifted, a mask mandate is still in place for public transportation through a CDC order. So the Centers for Disease Control order is still in place, which requires the wearing of the mask on public transportation. And everyone is still required to wear a mask also while taking any form of transportation. That's Metro, the county bus system, or any other type of public transportation. You're still required to wear the mask. So please continue to follow those guidelines and to wear your mask under those circumstances. Now let's do all we can to make sure that everyone stays safe and that everyone has the appropriate time they need to adjust to these new changes. Dr. Golson is also here today, and she's going to give you an update regarding the school system. I know that many of our parents and families want to know about the schools and what the decisions have been there. But before she does that, I certainly do want to once again say thank you so very, very much to Dr. Golson, Dr. Carter, Dr. Askew, for the tremendous work that they have done throughout this pandemic. It has been, for me, such a privilege to have the caliber of professional whose words I could depend on, and who I think have just been transparent and honest at every turn, and who have just really given us the best service we could imagine. And so I do want to thank them for protecting our residents and for protecting our beautiful children. Dr. Carter and Dr. Askew have consistently been a part of our COVID-19 updates and give our counties and have given our county's pandemic response, I think, a calm and trustworthy face. Again, these two pediatricians who have helped us make significant progress over this pandemic, and we could not have come this far without their wisdom and without their dedication, as well as the dedication of their teams. And so I want to take a moment to thank Dr. Askew, and to also say that very sadly for all of us today, today's briefing is the final one that Dr. Askew will attend in his current role, as Dr. Askew has now accepted the role of President and CEO, Chief Executive Officer of the Meyer Foundation. And so we could not be any more proud of Dr. Askew, and boy, we have been lucky to have him on our team. We know that he will continue to serve all of us well through his work at the Meyer Foundation, and we look forward to continuing to work with him to elevate the causes of Prince Georgians as well as all humans. And so we just thank you, Dr. Askew, and look forward to continuing to work with you. We've been really fortunate to have his leadership as DCAO of Health, Human Services, and Education. And his optimism, I have to tell you, has inspired this team at times when the rest of us didn't know kind of what was next. We could always count on Dr. Askew, and even though this is his last day, I want you to know that I have received steadily text messages all day and all night about the pandemic, including my updates that I received first thing this morning, probably 5 or 6 a.m. But that's the kind of commitment that we have seen, and we will miss it. Government can sometimes feel impersonal, but I hope that all of you out there also have felt Dr. Askew's compassion. I think it has come through in everything that he has done. He's put his whole self into this. And I just also want to say, before I move on to Dr. Golson, that I think many in the public don't get to see the many, many personal sacrifices that are made by the men and women who are in public service. And I can tell you Dr. Askew in his case, Dr. Carter, and I know also Dr. Golson, but in Dr. Askew's case, even at times when he was having his own medical challenges, traveled to have medical procedures done, he never missed a beat. Hospitalized or no, he never missed a beat. And so I want to thank him and thank Dr. Carter also for the many, many personal sacrifices they have made. They never let us down. And on behalf of Prince Georgians, we thank you so much. And so I'm going to turn it over to Dr. Golson, but again, want to end this by thanking Prince Georgians again for your patience, your understanding, your cooperation. And more than anything, I want to thank you for your love. I think that love drove all of our responses during this pandemic. And again, we know COVID-19 is still out there. We're going to continue to be vigilant and to be wise in all that we do. But I want to thank you for your love and for your sacrifices. And at this time, I'll turn it over to Dr. Golson.
Thank you. Good morning. Earlier this week, the State Board of Education provided additional flexibility to school districts in making decisions about mask mandates. I am extremely grateful to our county executive, to Dr. Askew and Dr. Carter for their continued collaboration and guidance, data-driven guidance over these past 2 years, and I appreciate the support in our decision-making as we had to work to provide opportunities to make sure that our staff and students were safe. We have implemented every tool available to the school system in an effort to mitigate the spread of COVID-19, including enhanced cleaning and sanitation protocols, free vaccination clinics in our schools, free weekly testing for unvaccinated employees, and random testing for our students in our schools. We provided free KN95 masks and take-home COVID test kits. In December, we returned to virtual learning through mid-January to stop the surge of the Omicron variant, a decision that has paid off for students, employees, and families. This is the final week of our take-home testing program. So I am pleased to report that the number of positive cases among students has consistently declined each week from 888 the first week to 246 this week. We have done our best to exercise due diligence at every turn, especially for our youngest learners, who were most recently provided an opportunity to receive the COVID-19 vaccination. For now, masks will continue to be required inside our schools and our office buildings. Students may remove masks outdoors while at recess and participating in spring sports. According to the Maryland State Department of Education's previous guidance, we have the opportunity to remove the mask mandate once the county population reaches 80% vaccination. We have time to work through what this change will mean for all members of the Prince George's County Public School community, including those with medical conditions, in addition to making sure we modify our testing and quarantine policy and day-to-day operations in collaboration with our local health department. It's important that all parents and employees can make the right decision for their children and their families. At whatever point that mandate is lifted, please note that masking would be optional, not required or prohibited, allowing families to make the choice and timing. My commitment to the health and well-being of the Prince George's County Public School community is strong. We will follow the recommendations of our healthcare professionals, and while continuing to use our mitigation strategies and evaluating how to implement changes to our current mask policy. I want to thank our parents, students, families, and employees for being diligent and working with us every step of the way to make sure that our students and staff remain safe. We are making progress and we're turning the corner, so please continue to stay safe and be well. Thank you.
Good morning, everybody. It's great to be here with you again. First, I'd like to thank Madam County Executive. Your leadership and tough decision-making has kept residents safe and healthy, and as I've said many, many times before, has saved countless of lives based on listening to the science and following the science much, much better than I think many other leaders have done across the country, frankly. Thank you, Dr. Golson. Your partnership and your leadership have been vital to the county's response. And thank you, Dr. Carter. You have followed the science since day one, and you have been our guiding light through this pandemic and a partner for me in this work, and I greatly appreciate it. And of course, thank you, Prince Georgians. You have worked so hard during a very difficult time. For 2 years, you have followed the rules, and you have kept each other safe and healthy. Your teamwork brought us together and brought us to this new chapter. The spread of COVID-19 continues to drop rapidly. As the county executive mentioned, our positivity rate is now just over 2%. Our weekly case rate is down significantly. As of in late January, the county had 731 new cases a week per 100,000 residents. As of yesterday, we were down to 44 new cases per 100,000 residents, which again, the CDC considers moderate levels of transition or moderate levels of spread, the only county in the region to have that level. Hospitalizations have also seen a sharp decline. A month ago, the number of people in county hospitals with COVID was 241. As of yesterday, there were 40 folks in the hospital with COVID-19, with 11 of those patients in the intensive care unit. Again, down to 11 in the intensive care unit and only 40 patients with COVID-19. Patients with COVID-19 make up now just 4% of the county's overall hospital capacity. The ability of our hospitals to give timely and quality care to patients remains in terrific shape. The healthcare heroes, and they truly are heroes, at our hospitals have been outstanding. They have saved lives every day in the pandemic and continue to do so. They built up their capacity to historic levels and maintained their physical and emotional strength to care for those who needed it most and needed it right away. We cannot thank them enough. The positive trends in all of our key metrics give us the confidence to lift the mask mandate. We have the tools to keep each other safe and healthy. Testing and very effective vaccines are readily available. And while we can safely remove our masks at this time, as the county executive has mentioned, wearing a mask indoors is still okay and won't be frowned upon. In fact, we encourage residents and businesses to do what makes them feel safest. We support Dr. Golson and the Prince George's County Public School System in the decision to take a more gradual approach to phasing out masks in our public schools. Our students, their families, and school staff have done a wonderful job maintaining the highest safety standards, and we are, again, very, very appreciative. The county and its partners will continue to provide rapid at-home tests and high filtration masks. Residents can pick them up at community centers and libraries and other locations and at other events throughout the spring and going into the summer. We will also continue providing testing and vaccination services countywide. In addition, the health department will, of course, keep its eye on COVID-19 and monitor the numbers and monitor our metrics. The virus has not gone away, and we expect it to be part of our lives for some time. We are in a much better place today, however, and we will remain vigilant and ask you to do so as well. Again, just some reminders that we've sort of stuck with throughout the pandemic. If you start to feel sick or you are exposed to a case of someone who had COVID, please get tested. We also encourage you to get tested right before a gathering or before travels. And if you are positive, please stay home and follow the guidance of follow our guidance and the CDC's guidance. Stay up to date on your COVID vaccinations. We may have to get more vaccinations as we move forward. We know that vaccines are safe and effective. The CDC data show that unvaccinated folks are more than 20 times more likely to be hospitalized from COVID-19 compared to those who got a booster shot. And again, speaking from experience of someone who got COVID after having a booster shot, much milder infection, and again, did not result in a hospitalization. Vaccines are saving lives. Don't forget that. Vaccines are saving lives. Anyone who is 5 years or older can get vaccinated. And anyone 12 or older can get a booster shot. By early spring, we hope the FDA and the CDC give providers the green light to vaccinate children 6 months and older. I know that there are a lot of anxious parents looking forward to that time. Vaccines give children the best chance to stay healthy and out of the hospital if they get COVID. Therefore, we continue to urge parents and guardians to get your children vaccinated and boosted if they can, as soon as possible. Finally, as the county executive noted, this is my last press conference as the Deputy Chief Administrative Officer for Health and Human Services here in the county. It has been an honor and a privilege to serve the residents of Prince George's County under the inspirational leadership of County Executive Alsobrooks. I am Prince George's proud of the way our residents displayed love of neighbor and community by heeding and trusting the science and following the recommendations that led us to where we were able today to make this exciting change in our mitigation strategy. I look forward to continuing to seek ways to help and support the well-being of Prince Georgians. Have a great day.
Thank you, Dr. Askew. And with that, we will take any questions. Tracy.
Yes, actually, I've received lots of emails about the mask mandate, and majority of our parents have asked that we continue to keep masks because our youngest learners just had the opportunity to receive the vaccination, and those are students ages 5 to 9 who we're continuing to monitor their vaccination rate. So for our community, many of our parents have asked to keep the mask on. Oh, I definitely have had a few. Nowhere in comparison to the number of parents that have asked us to keep them. Yes. 72.3. So the Maryland State Board of Education created 3 off-ramps for school districts to consider when determining whether to remove masks. The very first off-ramp was a recommendation of when the county reaches an 80% fully vaccinated rate, then school districts could begin to explore with their local health department the opportunity to remove masks. There were 3 off-ramps, as I stated earlier. That was the first one, and that was the one that we have chosen to follow. We are at 72.3% in the county, and the great thing is that our community can continue to watch those metrics. We do post them on our website, and so as we move closer to that number, we can then have conversations with our parents to prepare them for that option in the event that we hit that 80 before the conclusion of the school year. This is what I firmly believe is that what the masks have allowed us to do is to make sure that we removed any obstacles that could harm them and keep them from being in school. We learned that having masks and having vaccinations helped us to mitigate all of the variants that came, whether it was Delta or Omicron. Now we have a situation where our community feels comfortable wearing it, and as our county exec shared earlier, even though the mask mandate will be lifted for the county on Monday, people in our community and in their homes may still decide to keep their mask on. And when we have the opportunity to lift and hit the 80% threshold, we still will have it as an option. We find that many of our students appreciated the opportunity to have masks on, and some of our staff members do as well. We have 90% of our teachers who are vaccinated and 86% of our employees are vaccinated, but they still find comfort in feeling that having the mask on eliminates the opportunity for a COVID spread. Yeah, I don't have any data to support now that the masks are harmful. That is correct. Yeah, great question. So for us, over the past 2 years, we've used data to drive our decisions. And While those 3 off-ramps all were related to data, what I know is that I have the opportunity to speak to our local health officer every Friday. We converse about what those data points are and what it looks like for our students. That recommendation, those 3 off-ramps, were actually discussed with the Maryland State Department of Health, and that's how those off-ramps were decided. We're going to continue to use metrics to guide our decision-making moving forward. It has proven to be fruitful from the first day we started and until the last. So if my partners don't mind, if I take this opportunity to just clarify, we actually are not closing the community-based classroom. We're actually moving the program to another location. We have 5 alternative school programs. We are now having 2 9 through 12 learning programs, non-traditional, what we would call alternative schools. They're now alternative programs for 9 through 12. And we will now also expand seats for grades 6 through 8. So all the offerings that we provided at the community-based classroom will be offered in 2 locations instead of 1. It is unfortunate that information was shared that was inaccurate, but I did have an opportunity at last night's Board of Education meeting to clarify, respond to, and answer any concerns that our board members have around the consolidation and move of that alternative program. And that recommendation did move forward. That will be now presented to the County Council for full vote and approval. And we will then come back for a final adoption of our budget in June. Thank you for the opportunity. So we have actually a virtual learning program for grades 6 through for our secondary students. It was an application-based program. You have to have a 2.5 and limited number of student absences for our secondary program. For our elementary virtual program, we only implemented that program because our elementary age students did not have access to the vaccination. So prior to us offering that, I made it very clear that we would offer that option until the vaccination was available. We are grateful that that vaccination became available for that age group in November, and shared with families early on that we would conclude if the vaccination was available at the end of first semester, which was the end of January. Yep. Thank you.
Oh, we like this. Backflips are acceptable on this day. I think we should all be doing backflips.
What about those who have still some trepidation of wanting to have something like this happen? And also, Dr. Askew's the last day, you can talk about it from a health perspective on why that would be a benefit for how the county has been doing.
Thank you so much. So first of all, just to answer in 2 phases, the people who are doing backflips understand what I understand about what we just came through. The backflips are not just about the masking, but it's about what we had to overcome as a community. The jurisdiction that had the single highest transmission rate now has the lowest transmission rate in the region. And I'm glad that Dr. Askew even corrected that. I'm not talking about just in Maryland. We have the lowest transmission rate. We're talking about Maryland, DC, and Virginia, the lowest transmission rate. And so it justifies the decision that we've made. But having said that, I totally understand the concern and trepidation of any resident who says, I am not yet ready. I respect it. And what I've just said is we will respect each other's wishes. For those who want to continue wearing the mask and who feel safest doing so, we will absolutely support each other as community members until they feel safe to take off the mask. And so anyone who wants to continue, that's fine. It's totally fine to continue wearing the mask. And we're not pretending that COVID-19 does not exist anymore. As I just mentioned, even for those of us, including me, who got the vaccination and the booster shot and did everything we could to adhere to the guidance, still became positive. So that's possible. We're not pretending that it's not possible to still get COVID-19. But we do know that the vaccine and the booster reduces the illness that happens thereafter. My symptoms are very mild. But we know that people can still get it. So in other words, for residents who are still concerned, we get it. And it's totally fair, and it is fine for anyone who's not comfortable taking the mask off yet.
I think I've said this before regarding the county executive. I think she now has an honorary PhD in public health. I don't know if I could say it much better than what she said. I think the thing to remind us all of is that over the course of the 2 years that we've been dealing with this, we have stayed with our plan to stick with the science. We stuck with the numbers, we watched the metrics, and we made our decisions based on that. And that has led us to the point where we are doing extraordinarily well, not only in the region, not only in the state, but in the country in comparison to other places that are dealing with COVID. By sticking with the science, it made some of the decisions actually quite easy because we didn't change things unless the science told us that it was okay to do so. Right now, the science is telling us that our transmission rate is low enough that we feel very comfortable lifting the indoor mask mandate, and also recognizing that we still have students who are getting vaccinated and getting, as Dr. Golson said, have only had fairly recent opportunity to get vaccinated. So we feel very comfortable supporting Dr. Golson and the Prince George's County Public Schools and maintaining the mask mandate until we've reached a level of vaccination that, again, gives an even greater deal of comfort with respect to protecting our young ones.